Thank you for watching the Momentum Men's Ministry on demand page. Today, you'll hear a message from Dr. Sims on Tune Up for Life. Live smarter, live healthier. Enjoy.
Hello, gentlemen. It's good to see everybody again. I'm grateful and honored and humbled that you have me come and present to you today. Um, just give an honor to God and thank you guys for the opportunity. For you guys who don't know me, I'm Victor Sims. I'm an internal medicine physician at the Kelsey Seybold Clinic. We are a huge clinic now, 500 doctors, 24 different locations. One near you. So if you need a good doctor, let me know. We can plug you in somewhere into the system. But I want to talk to you guys today a little bit about things that men can do to actually improve our lives so we live smarter, we live healthier. And we tag this presentation Tune Up for Life because men like cars. And if you like me, I like cars. I like fast cars. And I like the whole idea of even driving and taking care of them. But we know that many people don't take care of their health. And in men in particular, we're worse than most people about taking care of our health. And some of us take care of our cars better than we do our own bodies and souls. Well, remember that as God gave us stewardship over everything in these lives, we also need to be good stewards of our health. It is a gift from God, not to be taken for granted, but to be used for his purpose and his glory. So part of it is maintaining these earthly vessels and keeping them functioning so we can do what we've been called to do as men, to be priests, providers, and protectors. So our health is important so that we can carry out our other purposes. Next slide. So we're going to talk a little bit about men's health in general, but some facts. Let me start off the bat by just saying to you guys that in the middle of this pandemic, this coronavirus thing is real. And so for those of you who have not been affected, you probably know people that are affected. Take it seriously, wear your mask, social distance, stay home as much as you can. Be careful, especially with your families about going out. Make sure that you protect yourselves. Our pastor is wise in that we're not starting to meet yet because he knows and has actually foreseen this spike that we're seeing again. So we are seeing another spike. Be careful and be mindful of that as you go into the holidays. With that being said, I'm going to start up front. As I just said, men really don't ask for directions. And just like we don't with cars and with directions with travel, we don't actually even with health. Part of that has to do with pride. Part of it has to do with the fact that our healthcare system has not been very effective about reaching out to men. So the life expectancy of men is about 76 years, 5 years less than women, whose life expectancy is about 81 years. And if you look at African-American men, our life expectancy is even lower. It's right around 70, 72 years. And again, a lot of that has to do with access to healthcare and the fact that we see doctors 33% less than women do. And again, women, because they bear children, they get introduced into the healthcare system earlier than we do, and they're better about following up. Because of that, their life expectancy is longer. Next slide. So periodic maintenance versus complete overhaul. This quote from Motor Age basically says, trying to keep the hood sealed for 100,000 miles or even 50 or 60, I mean, somebody, factory authorized or not, will eventually have to do a lot of work under the hood. And, you know, I have a master's in public health. And the reason why I got that master's in public health is I wanted to learn how to take care of populations of people. One of the main things you can do when you're taking care of your health is to get in, link in with a doctor early, and do preventive maintenance. And we'll dive into a little bit more about what that means. Get your screening test, see your doctor early, because you can actually do maintenance work to prevent catastrophe or having big problems that you'll have to fix later down the road. So when you look at men's health, and in particular, I want to pick some topics that African American men, what are the potholes? What are the things that we need to avoid? And so I brought up these 5 different health conditions that I want to talk a little bit about, and then we'll converse and let you guys ask questions. But heart disease, in particular cardiovascular disease, heart disease and stroke, high blood pressure, diabetes. We'll talk a little bit about prostate health, and then we'll talk a little bit about colon cancer. Next slide. So cardiovascular disease, damaging your pump, and what about clogging your pipes? By definition, when I say cardiovascular disease, I'm talking about diseases that affect you to cause you to have heart attacks or strokes. And it claims the lives of about 647,000 Americans each year. And to put that in perspective, more people die from cardiovascular disease than the next 10 causes of death combined. You can combine all the cancers, you can combine all the other reasons that people die, and they still don't add up to the number of people that die from cardiovascular disease in this country. And so one of the most common types of cardiovascular disease is coronary artery disease. And basically all that simply means is having blocked arteries in your heart. Risk factors include diabetes, high blood pressure, high cholesterol, lifestyle, and then family history. The big question that we should ask ourselves as men and as we get older is, what's your risk profile? What are your chances of having heart attacks or strokes or problems as we get older? Next slide. So high blood pressure, this is a particular interest of mine, and simply because it is the silent killer, especially among African-American people. We are 10 times higher than our white counterparts to die from a heart attack, or in particular with strokes in particular. And that's because we don't address high blood pressure. And recently, as recent as within the last 2 years, they've actually changed the definition of what high blood pressure is. And first, let me describe just what blood pressure is. So blood pressure is basically the pressure that goes through your arteries when your heart is pumping. And if you want to break it down and make it very simple, it's the heart is a pump and all the blood vessels are pipes. And simply the pressure when your heart is actually pumping, when it's actually squeezing, is the top number. We call that a systolic blood pressure. The bottom number, when your heart is actually we'll say relaxing, but also trying to pull blood back in and refill, is what we call a diastolic blood pressure. So a normal blood pressure is 120 over the top, over 80 over the bottom. We used to say a normal blood pressure was anything less than 140 over 90, but again, the definition from the American Heart Association and American College of Cardiology has changed. Now, what's considered stage 1 hypertension is 130 to 139 over 80 to 89. And that is the catch-all blood pressure range where you want to get serious and have a hardcore look at what your blood pressure is doing. Nowadays, we don't necessarily start treating at stage 1 hypertension, but we start to have a conversation with the patient about what things do we need to do going forward to actually bring that blood pressure down. And so we'll give that patient 6 months to a year to start doing things that can bring the blood pressure down. We'll talk a little bit more about that in a second. Stage 2 hypertension is defined now when you have a blood pressure that's greater than 140 over 90. That's when you really start to put patients on medications. Why? Because you know that if your pipe system sustains a pressure greater than 140/90 over time, you're going to have trouble with heart attacks and strokes. The percentage of people, of men in particular, with high blood pressure is higher in African Americans, like I just said, and that is a big risk factor for heart disease and strokes. Next slide. So keep your blood pressure on track. Which of these are you willing to do today? Number 1, get tested regularly. The other thing we can do that affects our blood pressure is watch your salt consumption. Those ribs we keep talking about at Burns, that they have a lot of salt. So you gotta make sure that that's not on a day-to-day basis, but you can do something like go walk and put your time in and then maybe balance it off with a rib or 2. Maintain an ideal body weight. As I get older, I notice it's harder and harder to stay lean, but make sure that you're doing the things to kind of keep your weight down, that you're eating correctly, that you're exercising. The other 2 things are things that we definitely can control. One is actually our alcohol consumption. You want to drink moderately. When I say moderately, for a man, that means to be at less than or equal to 2 drinks in a day. Anything really higher than that will actually give you trouble over time if you're a person that drinks regularly. And then stop smoking. Smoking actually decreases a substance in the body called nitrous oxide. Nitrous oxide allows your blood vessels to dilate and therefore decreasing your pressure. So people who smoke have added increase in blood pressure simply because their blood vessels squeeze down everywhere in the body. And again, what happens in one form of the body when it comes to that happens across the rest of your body. I see a question somebody asked, what about cigars? Cigars are still a form of tobacco, still a form of smoking, less as toxic as cigarettes are, but they still actually do affect blood pressure and affect your overall cardiovascular health. Most people who smoke cigars will smoke 1 or 2 a day. Most people who smoke cigarettes, they're smoking a pack a day. They're smoking 2 packs a day. And so that quantity makes a difference too. But cigars also are not harmless, so you got to keep that in mind. As well as marijuana. I know there's a lot of now places where you can smoke recreationally and it's lawful. But remember, alcohol is legal as well. You can drink as much as you want to, but they just don't want, they're waiting to arrest you as soon as you walk out of the bar and get into your car. So that's something to keep an eye on and be careful about. Next slide. High cholesterol, sludge in your fuel vessels. So when you think about cholesterol, what you got to think about it is the free floating fats and oils in your vascular system. And so the LDL cholesterol is what we call the bad cholesterol. It clogs up blood vessels that feed your organs, including the heart and the brain, which are your 2 most vital organs. The HDL cholesterol, high density lipoproteins, is what we call our good cholesterol. It actually helps clean out those blood vessels and increases your blood flow to your organs like your heart and your brain. So where do we find high cholesterol? Heavy fatty meats, in particular saturated fats. So you want to limit those in your diet. Red meats in particular. If you're going to eat meat, you want to eat leaner proteins. You want to do lots of chicken, lots of fish, which has omega-3 fatty acids. The omega-3 fatty acids actually increase and help increase your HDL cholesterol. HDL cholesterol is also increased when we do cardiovascular exercise. So Gilbert's walk, and by doing that even itself, weightlifting, etc., you're increasing your HDL cholesterol and therefore helping to clean your blood vessels out. Someone mentioned about a vegan diet. Well, vegan diets are good in the sense that they help you eat more natural, less processed foods. If you look at diets now, people say, well, does keto work, Dr. Sims? Is that the best thing? What about Weight Watchers? What about low carb diets? What about Mediterranean diets? And what about paleo? If you look at the thing about those diets that actually work, the fact is the one thing they have in common is they make everybody decrease the amount of processed foods that they eat. And if you're looking at processed sugars and the starches that you take into your diet, those things increase blood sugar, they increase cholesterol, and they increase actually free-floating fats in your body. So one big thing is to decrease the processed food. If you can do a vegan diet, that's great, but it is not necessary that you have to have a vegan diet in order to have a healthy diet. Next slide. So a little bit more about cholesterol. So total cholesterol levels, you want to be less than 200 milligrams per deciliter. The HDL cholesterol, you want to be as high as possible. Lots of what's going on with the HDL cholesterol are your genetics, but you can increase it again with exercise. Niacin, which is one of the B vitamins, actually increases HDL a little bit. And when you look at it and get a lipid profile done, you want your total cholesterol to your HDL cholesterol level, that ratio to be less than 4. And what that means is basically that your HDL, the good cholesterol, makes up a big chunk of your cholesterol, total cholesterol in your body, and helps keep your blood vessels clean. Borderline total cholesterol is about 200 to 239. And then if you have a total cholesterol greater than 240, that would be something that I would take a hardcore look at and be a little bit more concerned about. But a full lipid profile, if you're going to get it done, you want to check your total cholesterol, definitely the HDL, the triglyceride level, and your LDL cholesterol. And most lipid profiles when doctors do them, they do them fasting, need to be fasting for at least 8 hours to 10 hours, and they will check those, all of those parameters. Next slide. It's never too late to get the oil change. So what can we do today to actually help? Number one, know your cholesterol levels. We talked about avoiding and decreasing saturated fats, high dyes, high in red meats and processed foods. You're going to have a lot of saturated fats. You want to avoid that. Exercise, again, is key. And you'll see a slide here, 20 to 30 minutes, preferably 30 minutes, at least 5 days a week. Ideally, you do it every day, will help you. And then stop smoking. Work on stopping smoking. If you smoke cigars, make sure you limit the amount of cigars that you smoke. And then alcohol only in moderation. Next slide. What about sugar? A harmful additive fuel. And so type 2 diabetes is running rampant in our society now. About 7.4 million adults are what we consider diabetic without knowledge of it. They're diabetic and don't even know they have it. But we define diabetes as having an elevated blood sugar level. When we say elevated blood sugar level, if you were to test it fasting, any fasting blood sugar greater than 126 would consider, on 2 separate occasions, is the definition of diabetes. If you are 100 to 126, you're considered a high-risk group that we call pre-diabetes. Within that range, you have the ability to go back the other way and to bring that blood sugar down. How do we do it? We'll get into that a little bit more. But decreasing your processed foods and carbohydrates, again, exercising and maintaining a healthy weight are key, not only for high blood pressure, heart disease, and stroke, but also to keep you from becoming diabetic. Next slide. So consider being tested for diabetes. Number one, if you have any risk factors, and I'll tell you, being African American itself is a risk factor. But as we just said, maintain an ideal body weight, eat healthy, natural foods, decrease your processed foods, exercise regularly. And if you're a diabetic, you definitely want to keep up with your glucose levels. But by doing these things, you can prevent diabetes. And if you have diabetes, you can control it. And even this is a condition, many times it can be even reversed. Next slide. So talk a little bit now about prostate health. And people say, well, what happens as you get older in men? After you hit the age of 40, and unfortunately I'm 50 now, our testosterone levels start to drop over time. One of the things that happens as we get older and the testosterone level drops is the prostate actually gets bigger. The prostate is an organ that actually, the bladder runs through your tract to urinate, runs from the bladder through the prostate outside of your penis so you can urinate. As that prostate gets big, it starts to squeeze off the tube that empties your bladder to go outside of your body. And because of that, what happens is when the prostate gets bigger, people start to notice that they'll have difficulty with urination. So what kind of symptoms do they have? Incomplete bladder emptying. You go use the restroom, go urinate, and then not that long afterwards, you say, okay, now I got to go back to the restroom. What's going on? So frequent urination, especially at nighttime, you can gauge how well a person's doing or how much trouble the prostate is giving them by how frequently they have to get up and go to the restroom at night. Can you stop and start on command? Some people have trouble stopping and starting when they're urinating. So they'll start urinating, have the urination actually stop midstream, and they have to force it to restart. So that can be a sign sometimes of people having prostate difficulty. Difficulty postponing urination. When I got to go right now. That urgency. What's happened is the bladder is filled up, it's overfilled now, and those muscles of the bladder, which is a big muscle, the detrusor muscle, is now trying to urinate against the pressure of the prostate. So once it gets overflowed, then your body basically tells you got to go urinate right now. So we call that urgency. A weak urinary stream. People will go to urinate. And, when you were a kid, you had to be careful because if you didn't aim right, you urinate across the room. As you get older and that prostate gets bigger, that urine stream slows down. It's not as strong. But a weak urinary stream is something to pay attention to notify your doctor about. And then the last thing on this list, you'll see people that have prostate difficulties will have a problem where they have to strain or push to start that urination process, especially in the morning. So something to keep an eye on and look out for. Why do we say these are important things? Because there are two different conditions that can cause this. One is benign prostatic hypertrophy, which is the natural increase in size of the prostate as men get older. The other thing we want to be conscious about, though, is prostate cancer. We'll talk a little bit more about that in the next slide. Next slide, please. So talk to your doctor about prostate. Prostate enlargement is as common as automatic transmission. If we live long enough, you will have a bigger prostate. It will get big over time and grow. And so when you say that, what's the percentages of that happening? If you're 60 years old, then you probably have, or older, you have a 50% chance of having a benign prostatic hypertrophy or a bigger prostate. Men that are around 60 to 80, probably 80 to 90% of those men have a large prostate. Once you get over age of 80, it's close to 100% of men that will have an enlarged prostate. Benign prostatic hypertrophy tends to be more severe and progressive in African American men. It's something for us to kind of keep an eye on. Prostate cancer also seems to be at a higher rate and more aggressive in African American men. So we have to be careful and keep an eye on ourselves as we get older. Next slide. What about prostate cancer? The whole key to prostate cancer, and this slide says, detected early, live to be a classic car. We lose a lot of lives of men, in particular African American men, to prostate cancer because they don't get tested. And so for African American men, the risk of dying from low-grade prostate cancer is double that of other races. Someone asked a question, Jay just asked a simple question. So what is it that makes our chances as African American men higher than other men? Part of it's genetics that we don't understand. But for whatever reason, we get more aggressive forms of prostate cancer and colon cancer for that matter, and we get it earlier. The big risk factors that we know that increase your risk for prostate cancer is fatty diet. The more fat we have in our diet, the higher that diet is with processed foods, etc. It increases your risk of many cancers, but colon cancer and prostate cancer specifically, we know there are increased when we have fatty diets. So it's a leading cause of male cancer-related deaths, and approximately 8 million cases go undetected. So when they present with symptoms, that cancer is already advanced. So what are the risk factors in general? One being African American, part of that's genetic, part of that is lifestyle, in particular with a fatty diet. 2, family history of prostate cancer. And when we say that, direct family members, if you've had a brother or a father or a paternal uncle on your father's side, those increase your risk for having prostate cancer. Men over the age of 50, and for African American men, we actually should start getting screened when we're the age of 40, simply because, again, Black men get prostate cancer earlier and we get more aggressive forms of it. So routine screening for most men is between the age of 50 and 75. And people say, well, why is there a limit at the top at 75? Once you turn 75, when you start thinking about prostate cancer, most prostate cancers are slower growing. Most of them actually are to the point to at age of 75 or 80. If you find prostate cancer in the small foci of it, you probably will outlive the cancer. You'll die from something else before you die from the cancer. So at the age of 75, we start talking to men and considering their risks and figure out, is this worth us continuing to screen? It's not a little bitty surgery. You have to kind of consider the side effects of surgery if you're going to get it done. If you're younger than 75, your life expectancy is definitely usually more than 10 years. So you're going to definitely consider screening that person. And if that test comes back positive, you're going to do something. How do we screen for prostate cancer? So when we screen for prostate cancer, we do something called a PSA, a prostate-specific antigen test. That's a blood test that actually, if elevated, ticks off the doctor and then warns the patient as well that they may have prostate cancer. The second part of it, unfortunately, this is still in the dinosaur age as far as testing, but it's important, is a manual exam. When we say manual exam, that's actually a rectal exam where the doctor uses one finger to get into your rectum and actually feel for the prostate. The prostate sits right up against the rectum, and when the doctor does a rectal exam, you can feel the prostate to feel the size of it. You feel whether it should be a rubbery consistency. If that prostate is hard or if it has nodules, those may be signs of cancer. That's what the doctor's looking for when they do a rectal exam. So screening for Black men starting at age 40, not at 45, should be starting at age 40. And also for other men, you want to start screening at age 50. But you want to screen from Black men from the age of 40 all the way until they're 75. And the screening exam consists of blood tests and a rectal exam. Now, I have this case from many men will come, especially the men that are relatively young. Well, I just want the blood test. I don't want the finger wave. And then you'll have other people that will say, well, if you're going to do, why you got to do both? And here's why. The sensitivity or the ability to pick up a cancer if it's there using the blood test alone is about 75%. But that means that 25% of the time you could have the prostate cancer and miss it just with blood work. Now, if you did just the manual exam or just the rectal exam, that's about 70% sensitive, which means that another 30% of the time you can still have the cancer and it not get detected. When you combine both, you do the PSA blood test and you do the rectal exam, that sensitivity raises up to about 90–95%. So the chances of you picking that cancer up when you do both the blood test and an actual rectal exam is much higher. And that's why we do both. Next slide. So there is, I want to make a point here when we get to the actual screening here, because there's an error. We'll get down to that when we talk about screening. But when you talk about colon cancer, also African Americans at higher risk for colon cancer. The second leading cause of male cancer-related deaths behind prostate cancer. And now they've actually, within the last week, reduced the age at which we should start screening for colon cancer down to 45. It used to be 50. And then about 2 years ago, they actually said, well, let's look up and be a little bit more, careful and sensitive about it, because African Americans seem to have higher risk of colon cancer and they get it early. So they actually dropped the age of screening for African Americans to 45 about 2 years ago. Well, new data came out this last year that showed that everybody's actually starting to get these cancers earlier and they're more aggressive. And so as of last week, the U.S. Task Force and Prevention actually put out a release that said that all men and all women, all people should start getting colon cancer screening at the age of 45. Previously, that age was 50. And that actually came up to date even since the time we had these slides made. So both the American Cancer Society and the U.S. Preventive Task Force also announced that you need to start screening people at the age of 45. So risk factors actually is being age of 45 and older, African American, and also if you've got family history of colon cancer. So how do we screen and when do we screen? Again, now we're starting to screen at age for all people. That screening is wrong on this slide. I have to fix it. That's actually actually prostate cancer screening. Age 40, and you go all the way up until age 80 when you're screening for colon cancer. Colon cancer screening consists of only one of two things. Number one is a colonoscopy. And I know that sounds scary. Y'all are scary to me. I've just turned 50 this past December. I have mine scheduled in a couple of weeks. I'm not looking forward to it, but I know it saves lives. And if you get a colon cancer screening done, they take about 45 minutes to do. They use a long tube with a camera on it. What they're looking for doing the actual colonoscopy is they're looking for polyps. You see the picture there, and that picture there is basically the semicircle of what a colon looks like. They run a tube through you with a camera looking for polyps, and they see those little polyps. They actually go in and pluck those polyps off. And the reason why colon cancer screening is so important is simply because 95% of colon cancers are totally preventable. If you get a colonoscopy, they go in and they catch those polyps, they pull them out early before they develop or grow into cancers. If you have a totally normal colonoscopy, you don't have to have a screening again for 10 years. If they find low-grade polyps, and what I mean by that, polyps that have a low rate of turning into a cancer, they bring you back in 5 years. If they find stuff that looks suspicious, they bring you back on 1 to 3 years, depending on how suspicious it looks for cancer. But when you start talking about a cancer that's 95% preventable, that makes the colonoscopy worth it. I said there were two modes really to screen for colon cancer. The second way that we do it is something called Cologuard. I know you guys have probably seen this really corny commercial where this box is walking around talking to this black man about getting his colon cancer screening done. That is a test actually where you send in a stool sample, and that stool sample has DNA, has a DNA test where they actually are looking for the signs of blood and also the actual DNA for cancer in your stool. That test is good for 3 years. So for people who say, I can't either get the colon screening done with a colonoscopy or won't get the colonoscopy done, the second mode is a Cologuard. The third thing that is much less favorable, but I will mention it, is something we call a capsule endoscopy. For people who really can't get anything done, they want to have a look maybe not only at the colon, but also at the small bowel. They have them swallow basically a camera. It goes through the system. You poop that camera out, the doctor gets it, they plug it into a computer and look basically at a virtual colonoscopy to see what your colon looks like. A much less yield, and if they find something, then you got to go and get a full colonoscopy done. So the recommendation is at 45, start getting screening with an actual colonoscopy. If it's normal, get it every 10 years until you hit the age of 80. And at that point, that's when we stop screening for colon cancer. Next slide. So lifestyle modification. You want to keep running on all cylinders. So cigarette smoking, again, the most preventable cause of premature death in the US because it's a behavior that we actually can avoid or don't have to have. Cigar smoking, less toxic or less problematic as cigarette smoking, but you still have to be aware of it because it does still increase your risk of having cardiovascular disease. Again, it has an immediate effect on blood vessels and causes vasoconstriction because smoking cigarettes, cigars, even marijuana decreases your nitric oxide levels in the blood vessels, and that makes the blood vessels constrict. Everybody will hear the term hardening of the arteries. That means cholesterol plaque, constriction of those vessels from smoking, and also just actually getting old and those blood vessels getting stiffer and less compliant. Alcohol, again, major risk factor for high blood pressure, high cholesterol, heart disease, and stroke. You want to drink in moderation if you do. And for men, again, that's less than 2 drinks in a day on average. Lack of exercise, so that increases mortality all the way around. Simple thing like exercising 30 minutes a day, you don't realize the effect it has not only on your cardiovascular system, but also on your musculoskeletal system. As you watch people age, the big thing that will happen with them as they get older is they start to lose their balance, they start to get weak, they start to get skinny. And lots of people do cardiovascular exercise, but they don't do resistance training. They don't do stuff to make them maintain their muscle tone. And muscle tone is key because muscle tone is balance. Muscle tone is back and also core strength. That core strength has a lot to do with your balance. There's a statistic that I will throw out to you guys. If you're over 65 and you fall and break a hip, half of those people are dead in 5 years of that hip fracture. That's how important balance is, and also your ability and your gait. You can actually estimate how long a person will live by how well they can walk and what their balance is like, because it's that big of a determining factor. I had a question about wine consumption come up. Wine, although it is red wine in particular, has a small amount of some cardiovascular actual positive effects to it. You still want to limit that alcohol drinking, even with wine, to two drinks or 2 glasses or less in a day. Again, simply because the actual process of the alcohol itself is broken down into sugars and is broken down into fats. And so you still want to limit your alcohol consumption to the majority of 2 drinks in a day if you drink moderately or consistently. Stress. And if you look at the one thing that has been persistent during this pandemic, I think people have been going crazy. It's been the stresses of your everyday life. How do you get things done? How do you take care of all these people as the numbers go up? Am I going to get infected? What about my family? What about my kids' school? So try to be mindful of your stress factor. Do the things that help you reduce your stress. Make sure you're putting in your quiet time with God, getting your exercise done, because it accelerates things such as memory loss, infections, bone loss. And so it's important that you continue to do the things to keep your stress level down as well. And if you're having lots of problems, I know we had the psychotherapist, the psychologist talk to us not that long ago. There's nothing wrong with reaching out and getting some counseling and getting some help, getting some coaching if you need to. The everyday stresses of life, they can be rough in our society and in our culture, but it's important that we manage those. So that has a big bearing on your physical health just as much as it does on your emotional and psychological well-being. Next slide. Conclusions. Why are men lagging behind? Why do we have a shorter life expectancy? One big thing is access to care and going to see a doctor. Almost 60% again of men don't visit the doctor regularly. And so they have a reduced quality of life compared to women because those diseases will step up on us, will sneak up on us from behind, you not notice. Next thing you know, you're dealing with a big problem. So number one, find a doctor, choose a doctor, and establish a relationship with a doctor. Jay told me to mention a really good question is, how do you choose a doctor? I think the main thing is you look for someone you know you will relate to. If you have problems talking to women, don't choose a woman as your primary care doctor. If you feel more comfortable with a man, choose a male doctor. As an African American, we know that healthcare disparity data shows us that African American patients do better with African American doctors. You're African American man, find an African American man to be your physician if that's what you choose, if that's what you need, and they will give you good care. But the main thing is that you can establish a relationship with your doctor that you can be open and honest and really talk to. I think the three people you really need to be able to talk to and be able to open up and talk about everything are your physician, your priest or pastor, and your spouse. You should be able to talk to about anything. You should even be able to come and talk to the doctor sometimes about things that actually give you stress, that when you go to talk to your spouse about erectile dysfunction, prostate issues, etc. Because that openness gives the doctor the ability to kind of come up with solutions for you. There was a question about vitamins and supplements. A lot of the studies have shown that vitamins and supplements are helpful if you're lacking that in your diet. So again, the big thing you want to do is make sure you're eating healthy. And people say, okay, so what's the big deal with that now? Because people say, well, you need to eat organic, or you need to eat green. If you eat meat, you need to eat grass-fed meat. You want to get as whole foods as possible. And we're going to get into that a little bit more. But there's nothing wrong with taking vitamins if you need to supplement your diet. If you are on the go, the other thing you have to really look into is the fact that our nutrition is not the greatest anymore. We are a country that eats a whole lot of calories, but we don't get a lot of nutrients. So people will come to me and say, hey, I ate all this food, and I don't know why I'm still hungry, but I'm hungry all the time, Dr. Sims. And then when you get into the crux of what they're eating a bunch of junk. I eat chips, I'm drinking sodas. So the body is not getting what it needs to be fueled properly. And so if you eat a bunch of junk, you're getting a lot of calories, but your body soon after is saying, I still don't have the nutrients I need to function correctly. So you're still hungry, even though you're eating a lot of calories. So what we need to do is reverse that and make sure that we're getting in the nutrients that we need. Again, products that are healthy, less processed foods, and that makes a big difference in your overall health. But vitamins, if you find good multivitamins, they are safe to use. Make sure that if you have issues with kidneys, that you consult your doctor before you start vitamins, because the one thing with kidney failure or kidney problems is everybody can't regulate or get rid of the excess vitamins. And what happens with your body? People say, well, I'm buying $1,000 vitamins, Dr. Sims, because they're supposed to be the best on the market. Well, guess what? Once your body hits the saturated daily requirement for those vitamins, you're peeing the rest of that stuff out. So I told some of those patients, I said, you got some expensive urine going on if you're spending $1,000 a month on multivitamins. So multivitamins are great as supplements, but they are not to replace a good diet. Next slide. So watch out for the potholes. Again, hypertension and cardiovascular disease at the top of that list with high cholesterol, diabetes. Watch it over and take care of your prostate health. And then you want to make sure you're getting early and appropriate screening for colon cancer. Those are big issues that affect men and disproportionately affect African-American men. Let's talk a little bit more about prostate cancer. Somebody asked a quick question, what about low-grade prostate cancers? Again, this is now where you get into a realm of where urologists or specialists that treat prostate cancer can give you a lot of advice. Once somebody has prostate cancer, depending on their health, how good they are overall, how aggressive that prostate cancer is, because they actually grade it. We give something called a Gleason score. And the higher the Gleason score, the more complicated and aggressive the prostate cancer is. The lower Gleason score, the slower growing and the least damage causing that prostate cancer is. Based on the Gleason score and the patient's health, the urologist will come up with a treatment plan. For someone who is healthy, that's a healthy 80-year-old that happened to find out they had prostate cancer, that has really good health, or they don't think they're going to live very long, they may do what they call surveillance and just monitor that prostate cancer, do ultrasounds and do appropriate testing over time and just monitor that person. Someone that's young, that's 45 years old, that they found a small foci prostate cancer and it's aggressive, urologist is going to want to do surgery and take that prostate out. Why? Because that man is healthy, has a long history ahead of him, may or may not even have kids yet. They're going to be much more aggressive about that treatment. When you have people in the middle, the 70-year-old that has a lot of health issues, surgery will be dangerous. They may consider radiation therapy on that person or hormonal therapy actually on that patient. So a lot of the treatment of prostate cancers depend on the health and the condition of the man at the diagnosis, what the life expectancy is or how well that person is doing, as how long they expect for that person to live, their age, and then also how aggressive and how big that prostate cancer involvement is. And that's how we determine how we treat prostate cancers. So someone asked here, what's a good PSA level? When you check a PSA, a normal level is less than 4.0 milligrams per deciliter. If you're above 4, then you have some worries about what's going on. Sometimes other conditions can make that PSA go up. Irritation from a prostatitis. Just the big prostate itself can have an elevated PSA. And then one of the other things you have to really take care of and watch is that there are many patients now that are on testosterone replacement. Testosterone replacement has to be monitored with the PSA at least every 3 months because testosterone feeds prostate cancer. So you get a man that comes in and their PSA is elevated and they're on testosterone, that is something where you want to look at very closely. Next slide. So gentlemen, start your engines. Number one, hook up with a doctor. And I would tell you, any man that's 35 or older, you need to be seeing a doctor on a regular basis, at least annually for your physical. So just as tune-ups, never tell a whole story. In traditional auto maintenance, there's no modern maintenance. There's more to modern maintenance than just a mere spark plug replacement. So it's important that you're seeing the doctor, that you're running the appropriate screening tests at the appropriate ages. And so you need to be under a doctor so they can take care of you. In addition to that is health maintenance, getting your flu shots on an annual basis. When you turn 65, getting the pneumonia vaccine. When you turn 50 now, getting shingles vaccines. So there's multiple things that the doctors do to keep you healthy and keep you up and going. So they assist us in taking care of ourselves. We do our part on our side is maintain a healthy weight, eat right, exercise, stay away from activities that put us in harm's way. And the doctors are supposed to join us and then partner with us in our healthcare. Next slide. So keep your engines running, exercise regularly, maintain a healthy weight, and then get good sleep. Next slide, I want to talk a little bit more about that as well. So working out can reduce stress, it increases muscle mass, helps with your balance, increases your overall well-being, and then you just look better when you're exercising. So maintaining a regular exercise routine can help your health overall. And when we say, what's that like? That's about at least 20 to 30 minutes of moderate aerobic activity. Walking makes a difference. So that is a good exercise. Swimming, if you're agile enough and your joints are still healthy enough to let you play basketball, that's a great exercise. Swimming is a great cardiovascular exercise that makes you actually work pretty hard. All of those things. In addition, though, to your cardiovascular exercise, you want to also add some weight training somewhere, some resistance training, whether that's resistance bands or weights or just push-ups and sit-ups and squats without weights, what we call sissy squats. They make a big difference to your overall health, your balance, your muscle and skeletal health, as well as your mental and emotional psyche. Next slide. So maintaining a healthy diet, the best, most effective vitamins come in your food. But again, if you supplement on top of it, that's fine. Our food quality is now not great. Again, we get a lot of calories without a lot of nutrition. Food is pumped out and massively produced as fast as they can. And so that sometimes we don't have the nutrients that we should in our food. Control your portion size. You want to incorporate lots of fresh vegetables and fruit. Opt for whole grains when you can. Limit healthy foods and choose low fat proteins when you're choosing your meat. Watch your sodium intake and create menus to help you stay on track. Plan on how you're going to eat and allow yourself treats every now and then so you'll stick to your healthy diet. Next slide. Good sleep. The body repairs itself when we sleep. We underestimate the importance of sleep. On average, most Americans are getting about 6 or less hours of sleep, when a healthy adult really needs 7 to 8 hours of sleep. And that does not change no matter how long you live. People say, oh, I need less sleep, I can live off 4 hours. Your body repairs and tries to get itself back together when you sleep. So you need that sleep. Maintain regular sleep hours. Make sure that you're cutting off screen light, your computers, TV a couple hours before you go to bed. Try not to eat or drink a couple hours before you go to bed, because that makes a difference in your sleep health. Next slide. So cholesterol testing, people say, well, what kind of test do I need to get done and when? Cholesterol testing, every 5 years or so once you hit the age of 20. Blood pressure needs to be done regularly, at least once every 2 years. If you are 45 years or older, or if you're overweight or have other risk factors for cardiovascular disease, you need to be screened for diabetes. And pretty much everybody's starting to get screened now. They're starting to screen kids because we're starting to diagnose type 2 diabetes very early. Next slide. Testicular exams, it's okay to examine yourself, make sure you don't feel nodules, etc., but your doctor should be doing that annually. Prostate exams, you should start at age 40. That includes a blood test for a PSA and a rectal exam. Colonoscopy should start on everybody now at the age of 45, not only just at 50, but you should actually start at the age of 45. That's the newest data that we just got released this week.
Thank you for watching. If you would like to join one of our live sessions, then please go on Facebook, type in Momentum Men's Ministry, and like the Momentum Men's Ministry that has the gold M as its symbol. It will allow you to be able to get updated information daily or weekly about our live next session, as well as some encouraging information. So join us every Saturday at 7:30 a.m. Central for the TCWW Momentum Men's Fellowship. Also, watch us on Facebook, Instagram, or live.tcww.org for live worship each Sunday at 8 a.m., 10 a.m., and 12 p.m. Log on to thechurchwithoutwalls.org for all church events, announcements, and giving. Thank you for listening, and I pray you have a blessed day. In Jesus' name, amen.